Hi, my name's Phil and welcome to LabourVision, where we discuss Labour's policies. And in this video, I'm returning to a core part of every post-war Labour government's vision: healthcare via a free at point of access national health service. But rather than look at some individual policies, I've done that in the past, I'll inevitably do it in the future, I want to take a look at the point of view which is driving these policies this time. Because it's all too easy to see how the Tories have made the NHS less efficient, denied it resources, while spending increasing amounts of public money on private services to make it look like the money's still going in when it really isn't. We can see the famous chart produced by the Financial Times last year, which shows starkly the difference in waiting times between not just the last Labour government and the current Conservative government, but the previous Conservative government as well, night and day. For many people, there is an expectation that Labour will stop throwing money at rich donors, instead focus on the best way to spend the money in the interests of meeting the healthcare needs of the population. The waiting list will come back down and people will feel the job has been done. But if you read Labour's briefing paper on the NHS, they're arguing that this is not enough. That it's not just that the Tories are abusing the NHS in an attempt to persuade people that we should have a private system of healthcare, like the United States, but that the NHS has an outdated focus which needs addressing. Now, I'm not a medical professional, but I show enough interest to know that the NHS is facing increasing challenges now and in the future from things like heart disease, diabetes, cancer. The consequences of long COVID are going to take their toll in future years. Essentially, the NHS is having to deal with long-term chronic illnesses which come from a generally better standard of living, which means people survive illnesses which in the past would have killed them and survive for much longer, needing more social and medical care. And Labour are making this point themselves in their plan for the NHS on their website. They argue that when the NHS was first set up in 1948, it existed to deal with short-term injuries and illnesses. And they argue that this is still what the NHS is basically set up to deal with, rather than the chronic illnesses which are a much greater feature of our healthcare needs. And part of their plan to address this is to actively help people assess their health risks, give them information needed to work on prevention, which is easy and obvious enough, but a complete departure from the Tories. They insist on specifically not interfering in the way people live their lives. Oh, leave them to do what they want. Don't bother hassling them. But then blame them when help is needed. This is most classically demonstrated, I think, in their attitude towards people having children. They loudly proclaim that we should all be having more children. More children. We need a large workforce needed to sustain our growing retired population. Get busy with the children. We don't want immigration. Have more children. Oh, but woe betide you if you have children, then lose your job and then you can't get another. So now you can't afford the cost of living. And you have the nerve to say you're struggling to feed your children. Oh, that's your fault. You shouldn't have had children when you can't afford them. And the same is true in healthcare. Don't help people live fit and healthy lifestyles, but then complain at people for having the temerity to be ill and using up NHS resources. Part of the specifics of Labour's approach will be to screen, for example, all babies for rare diseases, but also predispositions towards deadly diseases later in life. That would allow the NHS to target people more at risk of certain diseases. The earlier you catch something, the easier it is to deal with. The cheaper it is to deal with as well. And to demonstrate just how holistic Labour's overall strategy is, it's interesting to see mention of good jobs, good pay, good housing, clean air in the paper on the NHS. None of these things will be delivered by the Department for Health and Social Care under a Labour government. None of them are things for the NHS to deliver. So why would they be mentioned in a paper on the NHS? Because people who have good, secure jobs, good, secure housing, can afford a decent standard of living, breathe clean air, are healthier physically and mentally. People in poverty, or where the insecurity of either housing or employment creates constant stress, are much more likely to become seriously ill and need NHS care. So taking those unnecessary pressures away, even though doing so has nothing to do with healthcare policy, helps your healthcare policy, because it means those people not only live happier lives, you ease the pressure on the NHS as well. You know, this healthcare plan, just like all of Labour's plans, doesn't just consider individual problems in isolation and then applies individual solutions. It links lots of other policies together. So whenever people say something like, well, what's the difference between Labour and the Conservatives? I mean, I usually roll my eyes because I'm thinking, well, you haven't actually read their policies, have you? You know, Google Labour missions, you get straight to them. I could go over the hundreds of individual policies that show a huge gap between the two parties. But if I had to mention just one difference, it would be this. The Conservatives have an ideological belief in the state being as small as possible, not interfering. It shouldn't even be noticed. It means that they only ever do anything when they have to, when they're forced to. So they will apply an emergency solution to deal with the immediate emergency problem and then go and sit back down again until it goes wrong in the future. This is why the Conservatives don't have a plan for anything. Labour, on the other hand, believe in the state driving improvements. Rachel Reeves will be talking this week about the need for a Labour government to drive a decade of renewal. And if you read any Labour mission paper, you will see not just individual policies, but connected policies. They do have a plan and it covers everything. Well, most things. But there we are. Hope you found the video interesting. If you did, please click the like button and subscribe to the channel. And until next time, I'll see you later.